Glenn Fowler. I'm coming to you from the parking lot behind me there, Willis Knight and Piermont, where 6 months ago I was on the second floor in the operating room about to receive a brand new hip. Fortunately for me, I had one of the top surgeons in the country.
40 years of seeing some of the Arklatek's best work. And yet, in recent months, it got harder and harder to climb those mountains, walk those riverbanks. Thought it might be over for me. Then I met this man, Dr. Cambize SHahrdar. He's an orthopedic surgeon at Willis Knight. He told me the pain in my leg was a severely arthritic hip and he could fix it. It's called a total hip replacement. Now, this surgery has been done thousands of times for more than 50 years. Most of those done using what is called the posterior approach, cutting through the gluteus and rotator muscles. I figured I was facing some serious pain and downtime. Then Dr. SHahrdar showed me videos like these, patients walking really well 2 weeks after surgery. I was amazed. Did some research, discovered Dr. SHahrdar is a popular guy.
I was getting people from Alabama, Mississippi, from Texas, from Dallas, coming here to get their hip replacement.
That was 15 years ago. At the time, Dr. SHahrdar was the only surgeon in this part of the country doing what is called the anterior approach to hip replacement. Here, the incision is in the front, and no muscles or tendons are cut.
You're literally cutting no muscle?
No muscle.
None.
We don't cut, split, or detach any muscle. Yeah.
What that means is usually less pain, quicker recovery. Sometimes the differences are stunning.
I spoke with this week. One had an anterior approach by SHahrdar, and the other one had a posterior approach by another physician. One guy was the anterior approach was playing golf again in 10 days. The posterior approach was playing golf again in 3 months.
So if you were having a hip done,
Anterior approach. Simple story.
All I know is what happened to me. A few hours after surgery, I'm walking. The next day, I'm home and ready to get better.
I've already put my pants on by myself. Now I'm putting my shoes on. A little sore, yeah? Check that out. 24 hours. Day 2. Walking my girl. Day 4. Raking the yard. How about that?
Day 5, my first trip to the gym. Now, nothing below the waist, of course, but I'm still pretty proud of my 21st century hip. 2 weeks, I'm back for a checkup. Dr. SHahrdar is happy with what he sees.
Good.
And this should last how long?
You know, people over age 65, studies show that there's a 90% chance it'll last 20 years.
20 years.
I'm planning on taking mine to the grave. A month out, I'm doing leg presses and body squats, something I have not done in more than a year. And already planning trips to walk those country back roads and stand on those mountain tops. And alongside my beloved Mountain Fork River. But not without the help of a talented doctor who says he never gets tired of giving people back a lot more than just a hip.
Makes me feel real good inside. I don't go out and broadcast it or share with anybody, but that's something I feel inside, almost a spiritual thing for me.